diagnosis, treatment, and prevention. Do you still remember the girl? If we want to confirm our diagnosis as flu, we need to do some laboratory tests. What we can do: 1. Isolation and identification of virus. The samples can be nasal washings, gargles, and throat swabs. Rapid techniques detect and identify the influenza antigens or genome of the virus by ELISA or RT-PCR. The virus also can be isolated by culture. The embryonated eggs could be used to isolate the flu virus. The amniotic and allotoic inoculations are common. The culture fluid is examined for virus after 7 days by hemagglutination test. Hemagglutination test is used to identify the viruses. Cell culture also could be used. The cells are examined by hemadesorption test. We can see from this photo, the viral infected cell expresses viral HA on the surface, then can adhere to red blood cells. Hemagglutination and hemadesorption are not specific for influenza viruses. Parainfluenza viruses and other viruses also have these properties. Besides the isolation and identification of the virus, the serologic test is also helpful for the diagnosis. Samples are paired serum specimens. HI, hemagglutination inhibition test, 4-fold increase is of diagnostic value. Again, the hemagglutination inhibition test, HI, is used to detect the antibodies in serum. Pathogenicity of flu virus. Source of infection is patients and asymptomatic carriers. Route of transmission is respiratory route. Season, usually in winter and spring. Disease is influenza. Sneezing can spread the flu virus to other people. Time course of influenza A viral infection. The classic flu syndrome occurs early. Later, pneumonia may result from viral with or without bacterial infection, or through immunopathogenesis. Viral production may be controlled within 4 to 6 days post-infection, but tissue damage due to innate and immune inflammatory responses continue. Systemic symptoms are caused by the interferon and cytokine response to the virus. Local symptoms, runny nose, cough, etc., result from epithelial cell damage, including ciliated and mucus-secreting cells. Immunity is subtype specific. Antibodies against HA and NA are important. Cell-mediated immunity also participates. If the girl is diagnosed with flu, how to treat her and how to protect people from the flu virus infection. As what we have learned, we use M2 ion channel blockers and neuraminidase inhibitors to treat the patients. Prevention. Vaccination is the most effective way to prevent infection and severe outcomes caused by influenza viruses. Specific prophylaxis. Inactivated viral vaccines and cocktail, which means trivalent or quadrivalent vaccines. The recommended composition of influenza vaccines for use in the 2020 to 2021 Northern Hemisphere influenza season by WHO. The vaccine recommended are quadrivalent vaccines. Strains of influenza A virus are classified by the following characteristics. Type. Host of origin. The host of origin is not indicated for human isolates. Geographic origin. Strain number. Year of isolation. Antigenic descriptions of the HA and the NA. So let's look at the first one of the vaccine. It is a type A virus. Host of origin is human. Isolated in Guangdong, Maonan. Strain number is SWL1536. Isolated in 2019. The subtype is H1N1. Prevent the epidemic of avian influenza is the first-line precaution. Outbreaks of avian influenza require destruction of all potentially infected birds. The flu virus is not stable at room temperature. It can be inactivated when heated at 56 Celsius for 30 minutes and is sensitive to ether and protein denaturants. Now let's go back to this question again. Will a killer pandemic like the 1918 flu come again? After learning the treatment and prevention, you may change your mind. If we can treat the patients efficiently and make new vaccines soon, the disaster may not come again. Key points of this chapter are: influenza viruses cause respiratory infections worldwide. There are 3 types: A, B, and C. Influenza A are segmented RNA viruses that regularly undergo genetic changes. The surface proteins, the hemagglutinin and the neuraminidase, can show granular change, antigenic drift, and sudden major change, antigenic shift. The disease may be pandemic, epidemic, or sporadic. Vaccines have been available for many years. Recommended annual for the high-risk groups in inter-pandemic period to reduce mortality, morbidity, and hospital admissions. The analysis of the case by applying the basic knowledge. To answer what is a disease? Based on the history, in flu season, sudden onset of the symptoms and signs, including high fever, severe headache and muscle ache, a little bit of runny nose, and a sore throat. The preliminary diagnosis is flu. To confirm the diagnosis, we can detect the virus by isolating and identifying methods, such as embryonated eggs and HA test, or cell culture by hemosorption test. Or we can use serologic test, usually hemagglutination inhibition test, to measure the antibodies titer in paired sera. Then answer the second question. Why did the person become infected? The source of the infection is patients and asymptomatic carriers. Transmission route is the respiratory tract. The severe disease may be caused by immunopathogenesis, such as cytokine storm. Last question, how to treat and prevent the diseases? Treatment. We have covered two kinds of drugs, amantadine and oseltamivir. Prevention. Please note, vaccine is the most effective way to protect humans. But because of the antigenic drift and shift, it's not always full protective. Have a break now. We will discuss paramyxoviruses when we meet next time.